Welcome, dear students, to your masterclass by MEDICOAPPS. I'm Dr. Sarosh. This is a special recording for you for National Immunization Schedule, and I hope this will be very easy for you. Everything in one slide. Ready? Let us begin. All right. So, just first we'll learn about what are the vaccines, what are the different, how is it given? Is it given oral or which form is it given? Okay. Then we learn about when it is given, what is that vaccine we give, and how much is the dose, and finally we'll have a summary of it. Okay, so let's begin. So what form it is? Okay, what form? You have oral vaccines, right? You have, just if you want to give in intradermal, below the dermis, just then somewhat deeper if you go, you have subcutaneous, and much more deeper would be intramuscular in the muscle. These are all the forms of vaccines. So what are the vaccines which are given oral? Can anyone say? Yes, very good. It is OPV, oral polio vaccine. Yes, and rotavirus, rotarix we say, rotavirus. And then you also have vitamin A. Though it's not a vaccine, it is very important that we give in the immunization schedule. All right, so intradermal, only one we know. What is that? Very, very simple. BCG. At birth we give, right? Subcutaneous are two. One is measles and the other one is Japanese encephalitis vaccine given in the endemic areas. Intramuscular, the rest of them. Okay, all the T series vaccine, everything comes in the intramuscular. I hope this is clear so far. Okay, now we'll see when these are to be given. The second question would be when. So very easy to remember. I'll try to make it simple. Remember like this: 0 dose is at birth. Then call that mother to come with the baby at 6 weeks. 3 weeks that we call 6 weeks, 10 weeks, and 14 weeks. Okay, and then you ask them to come at the age of 9 months. There's 1 month that you call, and then you call them at some particular years, that is 1.5 to 2 year, then 5 year. So this is up to 5 years. Okay, then you also have, you call them at 10 years when they grow up, and also at 16 years for TT injections. Isn't it? They're grown up now, you just need TT, that's it. So let us see what is given when. I hope now it's clear when. So now let us learn about what vaccine is given. So at 0, yes, you got the shot right, that is BCG shot, intradermal. Then you give oral polio vaccine, 0 dose. All right, at 6 weeks you give OPV, the first dose of it. Then penta has what all? Very, very important. Let's see what is penta. Penta is having DPT, along with that hepatitis B, and finally HIV, Haemophilus influenza type B. All right, so you give the first dose of penta, then you give rotavirus vaccine in the places where it is very common, and then you give PCV, that is pneumococcal vaccine, and finally the first dose of injectable polio vaccine. Okay, these are all first doses. These three, if you can see, are repeated here. OPV second dose, penta second dose, rotavirus second dose, and similarly OPV 3, penta 3, rotavirus 3. Okay, very simple. Whereas these two are given with a gap of this 10th week is skipped, so we don't give anything in the 10th week, the PCV and IPV. Instead of that, you give in the 14th week the second doses, IPV2 and PCV2. Is it clear so far? Okay, so now we'll go for the 9th month. What to give in the 9th month? Very, very important vaccine, this measles. Along with, or in places where rubella is common, you also add rubella. And in places where JE, Japanese encephalitis, is common, you give Japanese encephalitis live vaccine, intramuscular, remember? That is what is so. So then you call them for booster doses of the same measles booster dose, or if you're giving MR, you give that booster dose, second dose, and then you have the Japanese encephalitis second dose. Very easy. Now let us talk about, in this second year, you also give booster doses of OPV, and you also give booster dose of DPT. Clear? At 5 years, you call them and give only one vaccine, that is DPT booster. 10th and 16th year, remember, it was already mentioned, TT was being given. I hope now it is clear what you're giving and when you're giving this. Okay, and then let us learn about how much you give. Very simple. You have how much. So we have the doses, that is starting with 0.05 to 0.1, very little quantity that you give only for one vaccine, that is BCG. Remember, you have that BCG once again, yeah, BCG vaccine given in very small needle, given intradermal. Okay, then you have the more quantity ones, that is 0.5 ml, which are most of them, we'll talk about that later, and only one we have, that is 1 ml, that you give is Japanese encephalitis in injectable form. Vitamin A you give along with measles in the 9th month. All right, and finally you have one more dose called 2 ml, that is only for vitamin A, that you give from 9 months onwards, that from 1.5 year to 5 years, every 6 months, every 6 months. Okay, these are the doses that are given. The remaining all will be 0.5 ml. Okay, this is the most common. Remember which are the smaller ones, then you will come to know which is the rest of all. Okay, the next, let us summarize by seeing a very cute little baby, what all we gave from birth to the age of 16 years. Okay, orally what we are giving is, remember, OPV, rotavirus, and vitamin A. All right, then you call that and give the first shot of the birth, that is in the left deltoid region, that is intradermal. Only one that you give is BCG. Subcutaneous you give on the right arm, you call them at 9th month, that would be measles, or you also give is Japanese encephalitis. Okay, this is given subcutaneous, very simple. Remaining all you give intramuscular and the anterolateral aspect of thigh, not gluteus, remember. Anterolateral aspect of thigh, that is vastus lateralis. In this muscle you give all the intramuscular remaining. What are those? Penta, PCV, DPT. When you call for DPT, you give here. Okay, and finally you can also give PCV here on the left side also. So most of them are given intramuscular, that is anterolateral aspect of thigh. I hope this is easy for you now. Thank you so much. See you in the next class.